beginning. Keeping together is a progress. Working together is success. A very good morning to one and all present here. I am Aishwarya, your host for today. I am much delighted to offer a hearty welcome to all the people gathered here for the AHSCON 2024 in association with KAHPA on the behalf of Medical Imaging Technology of Mangala College of Allied Health Sciences. Every auspicious occasion commences with the lighting of lamp. May I now request all the dignitaries to kindly come over the dais to join for the lighting the lamp.
आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते ज्योतिर्जनार्दनः दीपज्योतिर्परब्रह्म दीपज्योतिर्जनार्दनः दीपो हरतु मे पापं सन्ध्यादीपनमोऽस्तु ते ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः ओ दीपब्रह्मरूपस्त्वं ज्योतिषां प्रभुरव्ययः आरोग्यं देहि पुत्रांश मतिं स्वच्छां हि मे सदा रवेरस्तं समारभ्य यावत् सूर्योदयो भवेत् रवेरस्तं समारभ्य.
A warm welcome is the universal language of kindness. So, I would like to welcome our beloved Chairman, Dr. Ganapati P. Sir, and Vice Chairman, Dr. Anita G. Bhatt Ma'am. A warm welcome to our Principal, Professor Pratigna Suhasini Ma'am, and Vice Principal, Geeta Lakshmi Ma'am. A cordial welcome to the Administrative Officer, Dr. Dharmaraj K. Sir. It is my pleasure to welcome all the teaching and non-teaching staff for today's event. A special welcome to the speakers of today's conference. So here I welcome Mr. Puneet Sagar, sir. Thank you, sir. Now I welcome Mr. Madan Kumar, sir. Now, I would like to welcome Karthikeyan Sir, Sales and Account Manager, Philips, Mangaluru. Thank you, sir. Last but not the least, I would like to welcome all the students gathered here. I am very excited to say that AHSCON 2024 is happening today as well as other various days in different institutions. AHSCON is a conference for the allied and healthcare students organized by KAHPA in collaboration with the Healthcare Sector Skill Council. With this, the students get in-depth exposure to various skills, knowledge about recent equipment or procedure, and also about the AI in healthcare. Kindly note, a feedback form is provided within the files. I request the students to kindly fill the feedback forms after each session. So without much delay, let's begin with the first session of the day. I request our first speaker of the day, Mr. Puneet Sagar, sir, CT Product Manager, Philips, to talk on the topic, Current Trends in CT. Over to you, sir.
So good morning, everyone. I think you didn't have any breakfast with you. Good morning, everyone.
Good morning, sir.
Thank you. My name is Puneet Sagar, and I'm taking care of CT product for South region. And I am based in Bangalore. I'm from Philips India Limited, right? So my presentation will be more for a, it will be not a presentation, it will be an interactive session. I'll ask something in between. If you are ready, just you can raise your hand or you can give me the answer. It will not be a very hard things, right? So don't be afraid of that. But I used to keep it like that only as an interactive session, right? So my topic will be covering the latest technology in the CT scan, right? and that will be the spectral CT. So as the name already suggests, spectral CT is a new kind of CT, or we can say the future of the CT scan. How many of you have heard about the CT scan? See, hand should be like this, not like this. Yeah, that's good. I'm not asking anything else, right? So if you have heard about CT scan, then the basic will be the X-ray, right? All the X-ray systems are almost having the same X-ray tube like of thing. In CT also there is a X-ray tube, right? So what is a spectral thing? So with CT scan, there are two main components. First is the X-ray tube. Second is the detectors that receives the radiation after passing through the patient. Okay. So in this spectral CT, there will be more information, because in CT we are limited to see the images. We can only see the morphology. We can only see the anatomy. But functioning we are missing in the CT scan. Okay. So for functioning, we were preferring for a PET CT or an MRI for a functioning type of thing. But with the help of spectral CT, or you have heard about dual energy. Who have heard about dual energy in CT scanning? Dual energy or spectral? No one. Okay. So this will be a new thing for you, and it will be a good thing also for you. So there will be a difference in spectral CT. We will have a video for that to understand what is dual energy or spectral CT. It's not working. So this is the video. Just see what is the difference if you understand what is the difference. So there will be a two layer of detectors. So in previous system there was one single layer of detector and the X-ray over that in a 90-degree angle, right? After patient was passing through. So this, you can see this is the wide bore gantry. So patient used to be inside this gantry, or this gantry, or this gantry, right? So there are three different technologies for spectral or dual energy CT. First is the KVP switching. So what is KV? You might know, everybody might be knowing what is the KV, that is the kilo voltage, that is the energy of the X-ray, right? So in KVP switching, there is a different KVP is switching automatically at the same time when X-rays are emitting to the patient, right? So we are getting a data from a different KV. So what is the advantage of getting the KV on a different stations? So the energy, or we can say the density or the anatomy what we are having in our, let's say in abdomen, there are different organs are there. Liver is there, kidney is there, fat is there, intestines are there, air is also there. So every organ might be having a different density. This is the normal anatomy, right? So depending on density, so CT images are totally dependent on the density of the organ, right? You all know all these things. If no, then it's completely okay, right? So the density which is having almost like a minus, like fat or air, it will be shown as a black on the CT images. And the density which is having a higher number, that will be shown as a white on a CT images, correct? If you have done an X-ray, in X-ray also, the density like spine or the contrast, that is visible as a white color, right? So white color is showing that X-ray didn't penetrate that organ or the density. So that is why it is showing as a white color, right? In comparison, if there is a very less density like air or fat is there, so it will completely penetrate those organs and it will show as a black color. And whatever organs are falling in between these densities, that will appear as a dark white or dark gray, or it will be of a different gray scale, right? So for that, on a different KV, it will absorb as a different way. So it is a big physics. I will not deep dive into that, right? So for different KV stations, the different density organs will, it will, what we can say, it will show as a different materials on a different stations, on a low and a high kV. So this one, sorry, I need to go back on this thing. Just give me a moment. It is not running. Yeah. So this one here, this is the Philips technology, what we are talking about right now. I'm not going on the competition because this is not a competition presentation, right? So I'll talk about my presentation only. So this first technology, that was from Philips. There will be a two set of detectors, one above other. In conventional CT, there is only one set of detectors. So X-ray will be passed from the patient in between in the gantry, then it will fall on the detector and then we will get the data, right? In dual energy, dual layer detector, you will be having a two set of detectors. The upper one will absorb the lower energy radiation. The lower one, that will be absorbing the high radiation. So it will absorb the different level of organs on a different kV stations. That's why we are getting a spectral of energy. So what is spectral? I'll give an example of a light, because there is a light, you can see only a white light, but in light there are 7 different colors, that is called Vibgyor. In same radiation, there are different level of energies are there, right? Starting from keV, kilo electron volt. Starting from 40 keV, it goes up to 200 keV. So on this different keV station, the organs or the kVp enhance at a different levels. That is the main physics of the spectral CT. So spectral is nothing, that is a different level of energies in a radiation, right? So what happens in a normal CT scan? We will see there are utilization of FOV. So we can say these are the challenges we used to see in a conventional CT, right? Then there is temporal resolution. So temporal resolution is used for moving object, moving organs. So which is our moving organ? That is heart. So for heart capturing, we need a good temporal resolution, right? Again, I am not getting into the physics, right? I am just telling what are the things. Then with conventional CT, there is a big concern, that is dose efficiency, right? For normal CT scan, for abdomen, we have to first scan patient for a plain scan, right? Then abdomen for a contrast scan, then for a delayed scan. So patient is scanned almost 3 times. Then sometimes for a delayed scan, we have to take another scan. So it almost like 3 to 4 times we are scanning a patient on a 120 kV, right? So yes, there is dose efficiency, dose concern is there. But yes, we have to scan the patient in order to get the this thing, right? Diagnosis. So for this, what happens? So right now I will start what are the we can say the different points we have started the different technologies of CT. So first in dual energy there was spin technology was there. So spin technology was like scanning a patient twice on a different kV stations, right? So this was almost like 7 to 8 years ago. But yes, for moving organs like chest or abdomen, we were not able to get good results. Then there was one more thing that was called split beam. Within a beam, the beam was half obscured by one filter and with another filter. There were 2 filters. One was obscuring the hard radiation, one was totally obscuring the low radiation. So it was becoming as a dual type of radiation within a one beam, right? So it was called as a twin beam. Then there was a spiral, a different type of acquisition for dual energy. Then there was KVP switching. So KVP switching is mainly done by GE system. right? So there they are doing with the KVP switching. So in between, KV is going up and down, right? Then there was dual source scanner that comes with Siemens technology basically. So with Siemens they have two different tubes and two layers of detectors that are positions at a 90 degree of each tube, right? You can see here one tube here and two sets of detectors, right, on the opposite of each tube. So this was called dual source scanner, right? And then was dual layer detector, which we are seeing with Philips technology, the dual layer detector. The upper one is the lower energy absorbing detectors. This one, the red one, right? And the lower one, the green one, there is another set of detector that is absorbing the high energy. If you have any questions, you can ask me please, right? Thank you. Okay, then there is a latest technology that is called photon counting, right? My friend from Siemens, he will be covering that because this technology is from Siemens, not from Philips. But yes, he was telling me that I will cover that photon counting. It is really a very interesting topic because every company is now switching to photon counting into, I think, in next 4 to 5 years, right? So this was the technologies, all we can say the points we have traveled till now for the photon counting. Then the technology behind us. So I am just going into little bit of physics. What is the difference with us? So there is this is the upper layer, this one. It is based on yttrium. This is the sample of a detector, what we have in a CT, one single detector, right? So this is detector, then followed by a chip with detector getting the data from the radiation. Then with the chip, it is converted to a digital signal. Then that digital signal is which we are seeing on a screen as a images, right? So you can see, you can assume what type of speed it is converting those data from a radiation data, then converting into digital data. And at same time, within a milliseconds, you are getting the images, right? So you can assume what speed they are working right now, okay? So upper one is the yttrium, lower one is the gadolinium oxysulfide based. So you can see the lower radiation will be absorbed by the this layer, and the lower the higher energy will be absorbed by the gadolinium oxysulfide based high energy detectors, right? So putting together, we will get the images. So what is the difference? What is the application we are covering? That is the main thing, right? So with CT, what type of images we are getting? Only gray and white images, right? So we can identify only the images with some diseases or some calculi or some images with some different diseases are there. But we cannot quantify what is the base composition. Like in MR, what we used to do in spectroscopy, we used to check whether what composition is there in the lesion, right? Choline is there or some hydrogen is there or whatever the elements are there. So for that, CT scan is now playing a very important role because in MRI, there are certain limitations. First is the claustrophobia, right? I am a claustrophobia. I cannot stay in a MRI, that gantry over for hardly for 5 or 10 minutes. My friend is laughing. So I think 30% people are claustrophobic from MRI machine, right? So that is the main thing. MRI is a good choice for a quantification for a lesion or whatever the disease is. But yes, CT scan is now also playing a vital role with the help of spectral CT, all dual energy CT. So what are the applications? So main application is monoelectric images. So with monoelectric images, the images are not seen very good here, but on my laptop you can see the images very good. But with monoelectric images, the main thing I'll show on the images, I'm just telling you what are the main applications. I have following the applications and images also. From there you can understand easily, right? I'm just telling what are the applications are covered on spectral CT. So first is monoelectric, then virtual non-contrast is there. So with the help of a contrast scan, right? We don't have to do a plain scan before that. With the help of VNC, virtual non-contrast, just with a single click, your contrast image will act as a non-contrast images, right? So you are just saving patient with one extra scan, and you are saving the dose also, right? Almost like 50%, correct? So with monoelectric and virtual non-contrast, you can save the dose with almost like 50% straight away. Then there is iodine no water. So the application is totally different. I can show you on the images. Then iodine density, Z effective, it is totally depending on the HU or density of the images. Then there is calcium suppression is there, right? Then the electron density. So going forward. So we have some papers on that. So I'll jump onto what our system has right now, the capabilities, or we can say the application, or we can say the features also. So first thing first, with our spectral CT, the first feature is 0.27 second rotation time is there for our spectral CT. So what do you understand by a rotation time? Anyone knows what is the rotation time for a CT? No? Okay. So rotation time is like that, in a center of a gantry, here, the tube starts rotation from the upper part, and it completes the whole 360-degree rotation and start and stop here. So that is called a rotation time, right? So it plays a very vital role in a CT scan. So the less the rotation time, the faster will be your scan, right? So application will be like, if we are doing a chest scan, the patient came with a very high breathing rate, he is not able to breathe well, mainly in an elderly patient having some complications. So almost like 2-3 years back, we were hit by corona. So we were getting the scans of chest very rigorously. So for this chest scan, we have to complete the scan very fast. So for that, we need a good rotation time. With less rotation time, with less rotating around the body of the patient, it will give you a good scan, right? So that is the rotation time. Then the detector coverage, that is the 8 centimeter coverage. So it should also be good as for the rotation time. Then the table, I'm just going fast a little bit. I'll show you the images. The main thing is the smart AI algorithm is there for CT also. So what AI algorithm, I'll show you in my consecutive presentations. Yeah, I'll start the second presentation with all the images here and the application also. So there are 2 images. Can you spot the difference between 2 images? What is the main difference between 2 images? Come on, it's not an examination. Raise your hand. Contrast. Who said contrast? It is correct. This image is having less contrast, this image having a more contrast. But with which contrast? IV contrast. Right? The name should be getting properly. We should pronounce that properly. IV contrast or OL contrast. There are 2 types of contrast, right? So I can tell you these are from a same patient, same scan. But with the application of mono energy, we can change the energy of the images, and we can get these type of images at a very low contrast. It is type of a post-processing. You don't have to scan again, you don't have to give the contrast again, right? So this happens with more of a technologist. What happens? There is a delay of scan sometimes, right? It depends on the patient also, it depends on technique also, it depends on the IV which we put like 24 gauge sometime, the flow is not good. So the contrast enhancement is not good sometimes with some patients or obese patient. They need some more contrast, right? For those type of application, you just give a small amount of contrast like 50 ml will be more than enough for almost like 100 or 120 kg of a patient, but you will get these type of images, right? Because the absorption of the contrast is very high with high BMI. But with the spectral energy with monoenergetic images, just change the energy of the scan and you can get these type of images, right? So you are not scanning the patient again. First thing, you are saving the dose. Second thing, you are saving the contrast also, because there are more elderly patient, their kidneys are suffering by the contrast which we used to give, IV contrast, right? So it is making two things at the same time. It is decreasing your dose, overall dose to the patient, radiation dose, and the contrast dose also, right? So you don't have to repeat the patient. So with spectral CT, our tagline is every scan is a spectral scan, and your repetition rates are very less. So if you are repeating your scans very less, so your physicians will be happy, you will be getting a good results, your radiologists are happy, and at the same time you will also be happy, right? Because you are not spending much time with patient. So that is the energy of the, application of the monoenergetic energy. Second, you can see the brain images. So there are three type of application we can cover on monoenergetic, right? With low KEV, you can increase the contrast of the images. You can see there is very less contrast seen on the images, but with the help of monoenergetic with low KEV, you can enhance the KEV of the images, right? Then image quality, definitely it will affected, right? And with the high KEV, you can obsolete the metal artifacts also, because there are very much chances of getting the artifacts if metal is there or some movement artifacts are there. So you can see artifacts. On the first image, you can see very high artifacts are there because of aneurysm clip will be there, right? And in the second image, you can see the sudden decrease of the artifacts because of the high KV, right? So high KV, low KV, you can play around in a post-processing thing. You don't have to radiate the patient again. So this is a post-processing type of thing. You got my point, na? If you have any doubt, you can ask anytime. Okay? Yeah. So these are the three images. First is the contrast image, right? Center one is the plain scan of same patient, same area. And the third image, this one, this is the VNC, virtual non-contrast of the contrast patient. So VNC we are getting with only one single click of these contrast images. So with help of contrast images, we can see the non-contrast images also. So you don't have to scan the patient for a plain scan, right? So almost 50% radiation is dose already we have saved for the patient as well as for the tube also, right? So main thing we are doing with the patient and for our system also, because we have to take care of our systems also. Biomedical system, my biomedical person will be happy every time, right? Okay, so how are the images? You can see the VNC images and the plain scan. And you can see the more noise are there in a plain scan because we have to give a less dose to the patient, but at the same time with high noise you are decreasing your image quality. But with the help of VNC, you can see the difference. With the same energy, with same dose, you are getting a better image quality, right? So at the same time, you are giving a good quality images also. You are giving less radiation to the patient. You are giving less, what we can say, less power of the, we are using less power of the tube also. So three things we are maintaining at the same time. So that is the advantage of spectral CT. And we are getting more applications also. There is a wide portfolio of applications coming in the next images. Right, so iodine imaging, right now for you it will not be important, but all the radiologists who are studying as a MD or DNB or the radiologist, everyone is concerned about the iodine uptake. So you can see the images here. We have the application that is called iodine imaging. So you can see 2 mg per ml iodine is uptake by this particular area, right? Before this, we used to get only HU of that particular area. HU is, what is HU? What is HU? Hounsfield unit, CT basic, right? Hounsfield. So who was Hounsfield? Who invented CT? Sir Godfrey Hounsfield. Come on. I did my course almost like 17 years back. I still know who is the inventor of CT. You didn't know? Okay, no problem. Yeah. So in conventional CT, we used to get only the HU or the density of a particular area when we are creating an ROI. You can see here 109 HU, right? But with the help of iodine density, we are getting the uptake of the iodine also. How much iodine it is getting up. If it will be a different type of lesion or something else will be there, like a diseased liver will be there or some lesion will be there, then there will be a different uptake of the iodine will be there, right? So that is the application we are getting with the help of iodine density. Same image. Then there is one more application that is called Z effective. It is showing the images, color type of coding images. That totally depends on density, what the organs have. The blue or the darkest color is showing the high density images, and red or the orange type giving the low density images. So what is the advantage? So we will see in the next images what is the advantage for these images. Then the uric acid imaging is also there. There will be overlay of the uric acid on the images also, right? You can see the different density of the electron taking up by the images. There will be calcium suppression images. So we got a CT and MRI for a same patient who was having a knee injury, and there was a very I think young patient was there. So he was complaining for very high knee pain. So we did MR and CT for both same patient or the same area. So you can see this is the conventional CT or a plain CT scan. You cannot identify anything from a conventional CT. But when you switch to a spectral CT, so you can see calcium is suppressed, the bone marrow is affected from the injury what he used to have, and the same patient was scanned under MRI also. So in MRI, the bone marrow or the there are some lesion on the bone, we can see easily, we can delineate the injuries of the bones easily, right? But you can see it is almost showing the same results as in a MRI also. I'm not saying it is a next option for MRI or this thing, but yes, with the help of calcium suppressed images from spectral CT, we used to get a more information for a CT image. Then you can see the neck images. First one, this one is the conventional CT. Yes, there is a lesion, it is seen there. But yes, with the mono 50 kiloelectron volt images, the contrast of the enhancement of the lesion came up very nicely, and the iodine no water overlay also, that changed completely, right, the diagnostics for the patient. Then you can see here also nothing in the conventional CT, right? But with the help of mono electron volt, you can see the density that is taken up by the organ. The contrast is taken up by the organ, and the enhancement is totally different at these images, lower images. Same, you can see the MRI images you can see of a lower abdomen, and the same as a CT scan also. So it is almost showing a same result as an MRI, right? So these were the images I just wanted to show the difference of a CT images, right? Pulmonary angiography was done for a patient, and this was the suspected area for the patient, but with the help of Z effective area, you can see there is a tissue, almost lost the tissue of the lungs, which we can see from the spectral images, right? And at the lower side also, the iodine density, the contrast or the iodine was not taken up because tissues were damaged at that side, right? These are the lung images. Then the different iodine take up by a kidney lesion is there, kidney area, right? So you can see different iodine density and see the standard deviation. On normal images, standard deviation is more than 15. That is not acceptable. But with help of spectral CT, standard deviation means there is a plus minus of energy will be there. It is almost zero for spectral, right? Then you can see the gallbladder. There is a large cholesterol stone in the gallbladder, but it is showing that it is enlargement of cholesterol, the gallbladder. But with help of spectral, you can see there is a difference in the density also. So it was a combination of like inflammation of the wall of the gallbladder, right? At the same time, cholesterol stone was there. You can see it is showing as a red. So what red was showing? With a low density, right? High density was a blue color, right? So it was just a cholesterol stone. Then obese patient, we used to get a good images. You can see very less contrast in a conventional images for a bariatric patient. But at the same time, with the help of spectral CT, giving out the lower KEV for the same patient, you can see the contrast is enhanced for the same patient, right? Then for pediatric also, for large patient BMI, it is there, right? Coronary, there is a very helpful images, or we can say the diagnosis is very good with for the coronary patients also. You can see myocardial infarct is there, you can see easily, you can identify easily, right? So here you can see there is stent. You have heard about the stent we used to get in an MRI when there is a blockage in the coronary artery of a patient. So in cath lab they used to put a stent. So sometime we used to check the patency of the stent. Patency means the contrast or blood is going through that stent. It is viable or not, right? The patency we have to check. So for that, the proximal and the distal and the lesion of the stent is clearly evaluated with the help of spectral, and you can see the images through the stent also. So your resolution is increasing, you can see through the stent also, correct? Then for the pediatric patient also, we can see easily the what we used to say, the defects. The defects are there most common in the pediatric patient. That is very common with the at the time of birth. So that also we can see easily, and with help of spectral we can delineate all the things, right? So this was the presentation from my side. Just give me 2 minutes. I will be jumping to the next slide. That is the latest innovation in our CT, right? Just give me 2 minutes. Can I have some water, please? Okay. So we will jump on to our new innovations, what we have right now, right? There are some workflows, or we can say the workflows assisting to the technologists and the doctors to the system. So there are some things which we will cover in the next slide, that is called as a precise suit. So precise suit is nothing the AI system enabled for our CT system. So everyone is jumping to AI right now. All the vendors, they are talking about the AI, not in the healthcare, but on the every enterprise with every what we can say the verticals, we can say in IT, in infrastructure, everywhere AI is working right now. Even in the phones, AI is working very heavily. So in healthcare, Philips is also working on a AI. So first thing what we cover, that is regarding the position. So there are some things, there are some very common errors that comes with a positioning, right? So you have did your X-rays sometimes. So for X-ray, position is very important, right? But with CT also, the positioning is very important. That is called the ISO also, right? There is ISO center also for a CT system, because in the gantry, you have to put the patient right in the center of the gantry. That is called ISO center. But if you miss that, what happens? The radiation, either it will go high or low because of the AI. Because AI goes with the data, right? And data that should match with their data also, right? So AI is good, but yes, AI need to be accurate. So first thing that is available with the AI with our Philips, that is the precise positioning. So with positioning, what we used to do, I'll go for the next step. So this, you can see the camera over here, this device over here. This is called AI camera, precise camera, right? My Siemens friend is laughing, he will also show. Okay, don't look back. Yeah. So this camera, what it is doing, so it is identifying the different body checks it is doing for a different positions, right? Let's say for the brain or for the chest, for abdomen, even for the limbs also, like hand or the foot or the ankle, it is checking while you are taking the patient for a CT scan, right? After what you are doing at the right now in CT scan, what we are doing, we are just asking patient to lie down on a table, and we are playing with the buttons for up down of the table, in out of the table, right? So we used to do it manually, but with help of the AI system, we ask the patient just to lie on the table, and as soon as you just put all the details of the patient and then you have selected the protocol, according to protocol, it will position itself. All the positioning will be done by itself. Let's say it will take up the table up to a certain ISO center, what I was talking about. Then it will position, like you have selected the brain or the chest, abdomen, neck, or any body part, it will position automatically, right? So almost we are spending 3 to 4 minutes for a positioning of the patient. So that helps with the system. Just you ask the patient just to lie down on the table, and rest of the work is done by the system itself, right? So that is called the AI position. This is the ISO I was talking about. The ISO for abdomen, chest, neck and brain, it will be different. So what AI is doing, it is almost simplifying the technician's work, right? It is almost getting lower the percentage of the error done by the technician, where there are almost like 70-80 cases per day. There is a hurry to doing the scans in a lesser time. So it was very common, then you can not getting this ISO center for the positioning accurately. But with the help of AI position, you can do that automatically. The system can do it automatically, right? So this is AI image, right? So you can see it identifies the head of the patient automatically by the system. You can see this, and it will position the system, positioning of the scan automatically, right? Then there is intervention suite. If intervention radiologist is doing, then there will be 2 monitors inside the gantry. We are not going into deep because this is for the radiologist and the intervention radiologist. But yes, there is a feature that is called the guiding of the needle, right? The AI feature of the needle, it will show the path to the intervention radiologist or the intervention who is doing the intervention. So it will guide you through the organ, right? And it will guide you for the lesion wherever you are getting caudally or cranially or lateral side, wherever you are going, it will guide you, the needle will guide you, right? So that is called intervention, AI intervention. Third thing is the cardiac one, because with cardiac, I don't know, I don't think you have done the cardiac scan for CT, right? So there is a very common thing when you will go for a CT scan on a table, your heart rate will increase automatically. So your heart rate will increase, then your coronary artery also will be, because there are very short coronary arteries or 4 or 3 mm. So that will be also moving with that high heart rate. So for that correction, AI comes up as a AI cardiac, or we can say is precise cardiac. It helps in getting mostly the RCA. I'll show you the images, then you'll get. Yeah, you can see the images are not good of the RCA. You can see here. But after correcting, it is just a click. It is just a new reconstruction. Your cardiac or your RCA or your coronary arteries will be corrected, and your lumen will be specified. We can see easily, and the diagnosis will be good with help of AI precise cardiac. Then fourth one is the images, precise image, we used to say. So what precise image is doing? Precise image, I'm jumping here. Okay, So you can see three images are there. First is the iterative reconstruction. You might not be knowing, so I'm not going into that deeply. So first is the feature which is called iDose. So with help of iDose, what we were claiming that we can decrease our radiation dose to almost 40 to 50%, right? And you are getting same type of images. Image quality will not be suffered, but with the help of precise image, further almost like 50% dose from the iDose, what we are used to getting almost like 40-50% lesser, that with the precise image, with the help of precise image, further we can reduce 30 to 40%, almost like 50% of radiation can be decreased. So you are getting those images, almost like 70 to 80% radiation dose will be lesser. So it will be good for patient, good for the scanner also, and at the same time you are maintaining your image quality also, right? So that is the advantage of having the precise image option. It is giving a good diagnostic images at almost like 70 to 80% of lesser radiation dose. Okay, so that was from my side. I think I covered almost from our side. Any question you wanted to ask? No questions? So either everything have been understood or nothing have been understood. Okay, thank you. Thank you. Ma'am, any question, please? Nothing? Thank you.
Thank you, sir, for sharing your expertise and valuable insight with us. Now, as a token of gratitude and honor, I now request Vice Principal Professor Geeta Lakshmi ma'am to present a memento to Mr. Puneet Sagar, sir. Here comes our second speaker of the day, Mr. Madan Kumar sir, MRI Application Specialist, Philips, to talk on the topic current trends in MRI. Over to you, sir.
Good morning, everyone. So, myself, Madan, I take care of MR application support for majorly for Karnataka and down south also. So today I think I'll be covering just a small topic on what is the latest technology we have in MRI, like coming from past 2-3 years, like what we are developing on. So first thing is we have a great challenge in helium, like getting helium for MR or to construct a magnet with high level amount of helium energy to get the resource. So now where Philips has come up with a new technology called helium-free technology. So how this helium-free works and what are the advantages, I'll just brief about this. Okay, so as you see, we have a latest 1.5T helium-free magnet which consume helium of less than 0.5 percent of helium. You can see the other image on your other side where you can see the image here. You can see the helium, it is has 1500 liters of helium, which is the conventional magnet. So ideally this magnet is heavier, and then basically you will all have been seen, MRs will be placed in the ground floor or in the basement level because the magnet is heavy. Now what Philips has done is, has reduced the helium consumption and made the magnet lightweight. So when the magnet is lightweight, and with lesser helium, there is no quench at all. So here, how many of them have at least gone through MR and gone through quench, or what are the emergency safety features of MR? Anyone? No. Okay, I'll just brief a small hint about that. So quenching system is in case of any accident, if a unknown person goes with a metal inside, or a wheelchair or a trolley which is stuck. So that particular moment, we have to ramp down the magnet. So when you ramp down the magnet, immediately the helium you have to quench the magnet, and then the helium will escape. So helium is a big price. It is a huge amount of cost for the organization also, and getting helium is also very difficult nowadays. So that what Philips has come with the 1.5 technology with a lesser helium consumption magnet, where the helium is sealed. So there is no escape of helium at all. And in case if an accident happens in MR with this blue seal, and next slide I'll show you how it has been taken over. So here, as I told, the advantage here with our helium-free magnet, you can see ideally the magnet are being placed at the lower level. So now we can even place this magnet up till 4th floor or the 2nd floor or 1st floor. So that was making more convenient for your placing or the seating allocation if you are already have a built structure where you don't need to again go down or make a separate place or how you want to place the MRI. So this gives you a very lenient way or a very easy planning for your new MR with a helium-free. So now coming up with this technology, how helium-free works and how AI helps in this helium-free technology with having this blue seal magnet controlled or monitored and how it helps you. So here in this blue seal magnet, we have this AI technology implemented. So this monitors the magnet, it monitors the pressure, and it even gives us the alarm. For example, it can even send a text message. We can do a setting like that. It will immediately send an error message to the biomedical or the maintenance people or even to Philips. And we will be seeing the pressure. So multiple technical things what we have to notice can be noticed with this help of AI. So now, earlier as I asked you, if there was any incident or any accident happened with the magnet, so we have to quench. So here what Philips has done is, they have totally removed the quench system here, where we off and on the magnet, so there is no ramp down. So as you can see in the first image, there is a chair stuck. You can see the chair is stuck there. So for removing this chair, ideally if it is a conventional magnet, you have to move the helium out, you have to ramp down, and then the downtime is more and all. And you first have to wait for the service engineer or an MR expert to reach the site and then do this operation. So now what we have done here is, the MR technician himself or the biomedical, even before the service engineer reaching the site, he can easily off and on the switch. So that is the AI which is implemented there. You can see the second picture where the person is like clicking off the magnet. So the magnet power comes down. And immediately on the third picture, you can see they can remove the chair out. So for example, if it is a cylinder or whatever small object or a big object, in just a couple of hours, the magnet power will de-energize, and then from there you can pick up the object. And again, you yourself or whoever the tech is using it, they themselves can easily energize the magnet back. They can on the magnet back. So that is a very, very advantageous thing, and we are not wasting a lot of time there. Ideally, I will even explain how much time it will take when if it was a conventional magnet. But now, with this help of this technology, less than like 4 hours or 4 to 6 hours, you are able to get the magnet back on working place. And in case if there is any additional damage, because if it is a hard metal, like our service people or the service expert team will reach out, they will check the shim or any damaged part to be replaced, or even before, if there is no any hard damage on the exterior place, you can still start doing the scanning. So that is a major advantage here. So initially what happens is, so as you can see in the figure here on the first place, it at least takes 3 to 4 days or to get back all this process to done. First, when you quench, the helium escapes. Then again, you have to see what are the parts gone. And again, you have to get the magnet to the cooling temperature with a lot of helium, like what will be used for. You have to cool the magnet again, and then you have to fill the helium again, required amount to make the magnet stable, and then ramp up the system. So this will ideally take 3 days or even 10 days now, depending upon the helium crisis. So now what Philips has done with this blue seal technology, they are finishing it less than a day. Within 6 hours, all this process has been completed, and you're free to go. And there is, you don't need to reschedule or appointments, or you don't need to have a breakdown scenario. So everything has been covered in a very short form. And the next advantages of this e-switch, the AI thing which we have implemented in this is, it has, as I told, it has the multiple scenario being maintained in this. It even checks the pressure, the room temperature, the humidity, and all these things can be linked to a device or a particular person's mobile device, where it can send the messages immediately. It will alert immediately, so that they can take a action prior before any big incidents happens or any failure happens in this. So far, I think you guys got an idea about how the helium-free works, right? Okay, so I'm keeping it very simple. I'm not going more depth so that it will be easy to understand. So next, going with the smart workflows. So not only helium-free with the magnet and other things, so we have implemented few smart workflows or like a AI kind of technology for the user also. So as you can see, there is a screen on the gantry. You can see a screen on the gantry there. So this screen, like we have got it very advantageous mode. Like if you enter a patient or you have a patient detail, you take a wrong patient with the same surname, there may be two patients. That is a common scenario in all the hospitals workplace. So when you have to check that or you want to confirm the ID number, so coming to the next slide, you can see the patient name is there, the ID is there, date of birth, everything is there. You can then and there only confirm with the patient. You don't need to go out again, go to the console, check what is the details given. Everything can be checked there with this vital screen. As like that, you can even see initially you have to go out and again check the vitals. For example, respiratory or the ECG gating. Now everything comes on the screen. So you don't need to walk in and out. And even this vital screen guides you to place the ECG leads also. For example, ECG leads, coil positioning, respiratory gating. So everything is gated. And we have multiple options here. You even can change it from feet first to head first. So depending on the patient comfortness, how you wanted to change. All those things, all extra features as given on this vital screen. So again, next we have implemented another AI feature called Vital Eye. So what does Vital Eye does? So for example, when you're doing a scan for abdomen or a pediatric case for a body scan, definitely there will be a lot of breathing difficulty. As my friend mentioned, if he is a claustrophobic patient, they'll have breathing difficulty initial stage. So then they'll feel afraid and then they'll definitely tend to move out. So those kind of scenarios will definitely place a respiratory belt on the diaphragmatic to observe the diaphragmatic motion. So now what we have done with the AI feature is using the infrared technology, we will be scanning like up till 50 centimeters up till the diaphragm, like 20 frames per second, the diaphragmatic motion. So without touching the patient, we will be able to analyze the breathing pattern of the patient. So how, just a small example how it happens is, the first image shows you with the respiratory belt, like the respiratory below, the traditional way of what we do for capturing the breathing motion. So the second image where you can see the vital eye, there you can see it with the non-respiratory gated, like with the help of AI, you are able to directly gate and you can look at the difference in the MRCP images. So this is the major advantage of the vital eye. So here in the helium-free, we have covered with vital eye, vital screen. So more of workflow improvement and makes your work more easier. And again, vital eye also, in case if you forget, you're doing a brain scan, immediately you want to do abdomen scan, you don't need to go inside again. You can just click on the vital eye and it will start taking the respiratory gating easily for you. And here I have just one application where I'm covering for 4D free breathing on abdomen, because abdomen body is the main challenge where for example, elderly patients age above 80 or pediatric patients where they don't tend to hold the breath or breathe easily. And major challenge where we saw is many of them wanted to do post-contrast or triphasic. So these places we have come up with the new solution called 4D free breathing. So in 4D free breathing is a very simple solution where you can do triphase without even asking the patient to hold breath. For example, if you had worked on CT, you definitely have to give breath hold. Similarly for MR also, few sequences you have to give breath hold. But now coming with the 4D free breathing, we are not asking the patient to hold the breath at all. So when you are doing a triphasic study, you can blindly ask the patient to just normally lie down and relax. So when the patient is even more relaxed and patient is also not asked to do multiple exercise on the table, you get a very good imaging, and this is a small example of free breathing triphasic images. So I think I'm complete with my topic, and any doubts or anything you wanted to ask about the helium free, just let me know. Any questions? No questions. Okay, great. Thank you.
Thank you so much, sir, for pouring us with your knowledge. I'm sure that all the students and the faculties have received a lot of information from you. As a token of gratitude and honor, I now request HOD of MIT Department, Mrs. Rakshita Ma'am, to present a memento to Mr. Madan Kumar, sir. Before we move on to the next session, I would like to welcome the speaker for the same. I extend my heartfelt welcome to Mr. Bhuminathan sir. I would also like to welcome Mr. Santosh Srihar sir from Siemens. So here comes our third speaker, Mr. Bhuminathan sir, CT Application Specialist, Siemens. Over to you, sir.
Hello, good morning all. Sorry, now it is the time to good afternoon already. Good afternoon everyone. So I'll introduce myself before we are starting the session. So myself Bhuminathan. So I'm based out of in Chennai. I'm taking care of the CT as well as the radiotherapy imaging in the CT application part. So today our topic is going to be in-depth understanding of CT softwares. So what and all softwares we have and this how will impact into the field. That we are going to utilize, we can able to see for next half an hour or 45 minutes of time. So today our agenda is going to be, first of all, we are going to see the dose reduction technologies and followed with that overview of Somatum Go technologies, which is our current running platform. And we can dive into the dual energy understanding of the clinical images. We can able to see some of the technologies as well as the clinical indications. Then we will see what and all scanners we have in the dual source and single source. We have introduced in the couple of years before something name is called the quantum technology, Neotam Alpha, so which is the quantum technology which will do all the photon counting CTs, so that we are going to see it for next half an hour to 35 minutes of period. Good. So first our dose reduction technology, we all knows before we are proceeding the any of the radiation exposure machine, we have to follow the ALARA principle. So ALARA, you know very well, it's as low as reasonably achievable. That is our mantra for the radiation. So for that, all the vendors and all our companies will be having some different kind of technologies we'll be using to reduce the radiation exposure. So the similar way, we can see we also have multiple technology because we are leading into the industry, the CT industry and other imaging modalities also to reduce the radiation exposure. So we can see the first of all the Carados 4D. In the general terminology, we can call this as a AEC. What is the AEC? All we know very well. AEC is called the automatic exposure control. So with help of the dose modulation, we can able to reduce the radiation doses. So if you see, according to the patient obesity, we can able to reduce the patient radiation exposure with this. Then followed with that, if you see, there is an option is called CARE KV will be there. CARE KV will called as once we position the patient is on the couch, so we can able to see the different type of patients are there. So we don't know which is the right KV level for the patients. So our machine will automatically select which KV need to be selected according to the patient obesity. So that we will call it as a fast KV technology or CARE KV technology. What is a CARE? So we all know we have to care the patient, not only for the patients, with the machine also. The technology is called the combined application reduce exposure. So with help of that, we can able to reduce all the dose reduction technologies. Good. So then, in case if we lower the KV, of course, all we knows very well, if we lower the KV level, we may get the optimized image quality. To overcome that, we may have to increase the MA level also. So for that, we need the powerful machine where we can able to deliver the we can able to deliver the very good exposure. So now we can able to see in the industry with a single source machine with the 70 kV itself, we can able to deliver the 825 MA level, which is the maximum one, so which is required for the patient scanning also. Good. And this is what the KV steps what we have from the 72 up to 140 kV levels will be there. So that 140 kV level is mainly we'll use for the obese patients. Rest of the patients and all we'll use it for 80 or 100, or if it is an angiogram patients and all, we may use for the 100 kV or 80 kV patients. Good. Then if you see the next unique technology from the Siemens, so which is name is called the tin filter technology. So you can see this is the normal conventional detectors. So you can able to see this is the X-ray tube, and there will be some of the filters will be there, which will called as a bow tie filter or like a wedge shape filters and all. So the similar way, this is in the down we have the detector will be there where we are capturing the light signals. But from the Siemens, what we did it, we added the additional one more filter is called the tin filter. So with help of the tin filter, what will happen? It will reduce, it will remove all the soft rays and scattered radiation. Only the hard radiation only will take. With help of that, we can able to get the one single X-ray, chest X-ray radiation. We can able to get the one entire CT chest. You will not believe, in the single X-ray CT chest, you can see this is a single X-ray CT chest, X-ray image. We can able to get the like this images. We can able to find out that the DLP is going to be around 21. 21 is nothing, it's a 0.01 millisievert. So that is the advantage for the, with help of the tin filter. This tin filter, we may not able to use for all the examination. We can able to use for the screening purpose, like an example, the KEB or thorax, lung screening or metastasis screening images. That is the advantage for us. Good. And now we will be taking a name is called the survey scan. So the survey scan, it is just to plan the area of interest from where to where we want to do the it's a CT scan. For that, we don't want to give much exposure. That is also with the tin filter, we have applied it. For all the body regions, we have the tin topograms will be there, so which we can able to utilize, and we can able to reduce the patient radiation exposure as well. Good. And there is a iterative reconstructions will be there. So as we all knows that there are three types of images will be there after acquiring the CT scan. First is called the FBP. FBP is called the filtered back projection. That is our normal conventional CT images we will call. So after that, in order to reduce the patient exposure, we have implemented the something is called the IRIS. IRIS is called the image reconstruction and image space. So the advantage of IRIS is going to be, so we can able to either activate or deactivate. So some of our radiologists may expect the image quality. They want to, some people may expect they want to the smoother images. Some people they may expect from the some softer image quality. To overcome that, what we have implemented, something is called the Sapphire, which is going to be a sinogram affirmative iterative reconstruction. As we all knows, the sinogram is a raw data based. So the raw data based reconstruction, we can able to reconstruct the images with the various strength level, 1 to 5 strength levels. So with help of that, we can able to get the optimum image quality according to the radiologist taste. And followed with that, in the current around some 3-4 years before, we have implemented the model based reconstruction also, which name is called the Admire. So it's a model based reconstruction where we can able to go with the one step higher, and we can able to get the better image quality also. But in the current industry, many of the scanners we are using with the Sapphire technology, which will give us the excellent image quality, which is the FDA approved product, which is a 60% radiation exposure, we can able to reduce it. Good. And right now we are using another technology, name is called the XCAR. So as we all knows that you can take this as the entire gantry. So from the 10 o'clock to 2 o'clock positions on the all sensitive organs will be there. An example, the eye lens or the female breast or the gonads, all the regions will be there. So what we, as a Siemens, we did it, from the 10 o'clock to 2 o'clock positions, we reduce the radiation level to from the 100% to 10%. So because we don't want to give much radiation to our sensitive organs, so with help of this, we can able to reduce the complete radiation exposure for our sensitive organs. And with help of this, we no need to tilt the gantry also. So we can able to utilize the digital tilt, and we can able to do the things. Good. Next, it's very important. The heart of the CT scanner is the two parts are there, two hardware parts. One is the detector, another one is the X-ray tubes. So the detector, what we are using is the leading technology, name is called the Stellar detector. So with help of the Stellar detector, we can able to achieve the slice thickness of 0.6 mm, and followed with that, as I told you, in the current Noyatum alpha scanner, which is the photon counting, in that we can able to go 0.02 mm. You will not believe, in the current industry, all our friends are using up 0.5 only is the least, but with help of the Noyatum alpha, we can able to go with the 0.2 also. I have some images in future in other slides, so we'll just see that with help of that. And we are using up fast planning technology, so you can able to see now it is not planned by our technologist. So you can see once we taken the survey, so the machine itself, it will plan automatically. So that we will call as a fast planning. So in the what we can say, in different organs, we have the different fast planning is there. So with help of that, in example, if it is the chest, so it will cover from the apex region to till diaphragm by automatically. even it is a zero-click processing one. So else we may have to plan it up by manually only. In case if it is a high throughput center, or in case if our technologist missed to plan some other regions, just assume if you have some 4-5 phases, arterial, venous, and all the phases, if you missed to plan it up, we will end up with some bad image quality, because which we may not able to plan it up. So with help of the fast planning, the system itself will plan automatically, it will give us the images. Good. And now, right now in the current scenario, if you see that oncology patient means like cancer patients are increasing tremendously. So for that, CT is one of the crucial factors to identify the screening. So for that, we are doing the chest and abdomen scans. So in case, an example, if you don't have the flux dose profile, so what we may have to do it, we have to deliver the uniform dose from the chest to up to the pelvis. But in the current technology, you can able to see up to the thorax level, it will deliver some different radiation exposure. When it comes to the abdomen level, you can able to see obviously my radiation levels is increased, because this is going to be a thicker part. So else we may have to give 3 or 4 times additional exposure to the CT chest. Good. Now we all know that after 40 years, people have to do the calcium scorings. So calcium score, it's nothing. We want to see the deposition, means the calcification depositions in the heart. So for that, in older days, we will be depending with the 120 kV or 110 kV only. Right now, we have involved something is called the any kV calcium score. With help of that, from the 80 kV to up to 140 kV, we can able to utilize it. So that is the advantage. Whereas in the obese patients and all, we can able to utilize it for this, even in the higher kV also. So we can able to see this is the pediatric patients. The scan is done in the Somatum Go Top machine. And you can see this entire scan timing is going to be 9 seconds from the head to toe. So the DLP, you can able to see it, it is very, very low. It is a 75 DLP only. With help of all those radiation exposure, we are reducing with help of all those technologies, we are reducing the radiation exposure, and we are achieving the very good image quality with help of this. Good. So now, we will see something is called the My Exam Companion. So which is a very unique features for us. In case while doing a patients, we may have to see either patient can able to breath hold properly or not, that and all. So right now we have something is called the My Exam Companion option. With help of that, what we can able to do it, just assume if we have the ICU patients. So that patient can able to hold the breath hold of less than 5 seconds. So once we taken the survey, our system will ask how long time patient can able to hold the breath. Either it is the low, mild, moderate. So an example, if you give the low, so what will happen? According to the low level, so it will take all the parameters, it will adjust and it will give us. Else, we may have to adjust by manually all the parameters. So that might be difficult for us, because when the patient is on the table. So this AI technology which we implemented in the My Exam cockpit. Now we can able to see. That's what the patient may be it's a less than like a 10 or 15 years old, or the mid age, or the patient obese patients. That everything with help of the AI My Exam Companion, we can able to do the radiation level exposure down, as well as we can able to get it the very good image quality also. Good. This is what I told you. Now you can able to see this is one of the cardiac protocol what we have selected, because the cardiac is one of the complex procedures we all knows. But it's with our Somatum Go technologies, we made it a bit easier. So we can able to select whether it is a heart rate is regular, moderate, or minimal. So according to the patient, the protocol will be getting selected automatically. Just assume if you have some higher heart rate. So what will happen? We have something is called the arrhythmia protocols. So that arrhythmia protocol will get selected automatically. In case if it is a patient heart rate is lower side, so what will happen? It will go to the prospective mode by default. So that is the advantage. Good. So in the last 2017 RSNA, we have implemented something is called the Somatum Go family machines. From that time onwards, we are utilizing the different type of approaches to get the good image quality and radiation exposure and digitally driven machines with a complete AI technologies. So now we can able to find out this. First, our technology name is called the Scan and Go. Then quality checks will do. That is going to be check and go. Followed with that, we can able to see the post processings. Whatever we want to do, the bone removal or 3D reconstruction, everything will done by automatically. which we'll call as a recon and go. Then we have implemented something is called the view and go to verify the images to do the automatic AI based post processings. Well, so first we will see the scan and go technologies. So we can able to see this is the scan and go which we are giving by standard one tablet along with the machine. So with the help of the tablet we can able to register the patient name and we can do the planning everything except the radiation exposure we can able to do in this tablet. So the advantage of this tablet furthermore we will just see it. So in case if you want to see the ECG getting ECG signals, we may have to go to the console room and we may need to see it up, but with help of the tablet we can able to find it out, we can able to see in this. And just assume in our hospital if the patient like some ICU or semi-conscious patients are there. So after positioning the patient, we may have to go for the patient registrations everything into the console room. Meanwhile, the patient will be, unless until to register the patient we cannot able to do the scans, so the patient will be ideal. So what we can able to do it, we can able to register the patient registrations in the tablet itself, except the radiation start. We can able to do everything in the tablet itself. That is the patient registration, history collections, everything we can able to do it up. So we can call this is the mini console room. This we can able to do it up. And while doing a biopsy procedures, we can call this as a small intervention monitor also. So while doing a biopsy procedures, we can able to view all the patients, like the patient real-time needle positions and all, we can able to evaluate with help of this tablet itself. That is the second advantage. And many of the times, while doing a scanning, our radiologist may not be in the console room. So he may be with the ultrasound room. So in this tablet, you can carry to our radiologist room and you can just get the second opinion from the radiologist. So either we want to proceed with the contrast or like some provisional report if you want to give, you can just carry with this. So this is the digitally driven tablet. Good. Now you can able to see this is the one historical diagram. So in case if it is a standard workflow, so after positioning we can able to see lot of time we will be in the console room only. So you can just two different sessions will be there. This is a standard workflow. Right now what we are following up with the help of the mobile workflow. So we can be with the patients more time and we can minimize the presence in the console room. Good. And this is what we will call as a check and go. So we can able to find out the patient is wearing the belt. So before proceeding the scan, our machine will ask whether we want to do the scan furthermore or not. So if you click yes, then you can able to proceed it. Then it will indicate to the radiologist, our technologist has given even the metal also, yes. So it will proceed to the next level. This will applicable for the even implants also. In case what will happen the patient will be having a shoulder or neck implants will be there. That cases and all, if you give the yes, automatically the metal artifact detection will get applied. Else we may have to do it by manually only after completing the scans. Well, and if you see there are multiple reconstructions we made it up automatic. So with help of the recon and go, we can able to get the automatic reconstruction of axial coronal sagittal, which is the standard way. But right now we implemented the coronary vessel CPR segmentation also. CPR is nothing but curved planar reconstructions and the automatic spine and rib labeling also. So right now we can able to do the entire ribs automatically and even we can able to flat the ribs and we can able to see the metastasis or fracture positions also, which we'll see in the future other images. Good. And this is what I told you, the aspect score will be there so that the stroke predictions we can able to do it with the inline itself. The calcium scoring, heart isolation, we can able to do it in the 0-click itself. Good. So you can able to see this is what automatic vessel segmentation, the automatic vessel labeling. So you can able to see the patient is having the calcium scoring in the LAD. LAD is left anterior descending artery. So how much is the calcium depositions, everything will be there. This will do the reconstruction by automatically and it will send it to our radiologist by automatically. Else we may have to do by manually. So this will save our time as well as our efforts also. Good. Now for peripheral angiograms and all, if you want to do the post processings, we may have to depend our workstations. Right now whatever we are doing all the post processing, everything can be done with our post processing, in the acquisition workplace itself. So which is a 2-click post processing. So which will do from the proximal and distal click, we can able to trace it up in the 2-click itself. Good. So you can able to see this is the CPR suctions. This everything is done by system itself automatically. You will not believe we have not done anything by manually. So the RCA, LAD, LCX, everything will done by automatically. Good. Now this is what I told you. You can able to see to count the fractures, it is a very cumbersome work. In case, in example, in between we missed it some of the ribs, we may have to label it from the beginning only. Right now we have a technology where we can able to do with the automatic labeling also. And you can able to see always our ribs will be kind of the floated ribs. Right now we can able to see this ribs are kind of the flat. So with help of this image, in case if you have some metastasis in particular location, which we can able to see it very nicely. Good. Now we can able to see, this is what I told you, the IMR images. With help of the IMR images, automatically the metal artifact reduction will be done and we'll be getting a crystal clear images. Else we may have to do it manually, else we have to select it for the higher KB parameters to reduce the patient radiation exposures. Good. This is what the peripheral angiogram, you can able to see, this is the zero click post processing, because this lower limb angiogram and all, as we know, it is a complex examination to do the bone removal options. Good. Now you can able to see next option is called the aspect scoring. So in case if we get some of the normal brain patients, what we will tell, like we will just see the HUs and it will give us. But with the help of the aspects, aspect full form is going to be Alberta scoring program and the early stroke detection scoring. So in case if you can able to see it, this aspect score is 9. In case if it is less than 5, the patient stroke prediction is higher side. So in the normal CT imaging itself, we can able to find out. This is not like a contrast based images, it is in the plane based images and it will give us by automatically. Good. And as we all knows, the neuroperfusion will be getting by default. Cerebral, there are 4 types of images will be there. Cerebral blood flow, cerebral blood volume and MTT and mean transit time will be there. With help of the advanced post processing, we can able to get the penumbra scoring also, which will called as a PRR. PRR is called the potential recuperation ratio. So how much of the cells we can able to save from the infarcted regions, so that we can able to see it up. So these are the 3 images of the images. Now you can able to see in the last slide, this is the cerebral blood flow. Now we can able to see the cerebral blood volume and Tmax will be there and MTT will be there. And the with the help of the Somatum Go Top machine, we no need to repeat the one more time the carotid and cerebral angiogram. In the first time itself, we can able to, in the one shot itself, we can do the neuroperfusion as well as the carotid and the cerebral angiogram in the one shot. So this will helpful for us to reduce the patient contrast media also. Else what will happen it, once we complete the neuroperfusion, we may have to repeat the again cerebral angiogram. Good. So we'll just go to the some of the cardiac angiogram. So this you can able to see the valve is it's a pumping up. So now you can able to see this is the biologically 1 millisecond will be there. And as we all knows that if you want to get the better image quality, so we need the 3 main important factors. So temporal resolution, we need the fastest temporal resolution. So with help of the dual source equipment, we can able to get the 65 millisecond of temporal resolution. So without any beta blocker tablet, we can able to do the coronary angiogram images. You will not believe, without any beta blocker images. So if we like in case if the valve is moving up like this, so that we can able to capture it very nicely with this, and the higher spatial resolution should be there to identify the better image quality yet. Good. Now we can able to see this is the AI based calcium scoring one, and our system will give us by automatically the coronary age also. We can see this patient has tentative approximately around some 50 to 60 years, and according to the calcification, how much is the patient heart age also we can able to predict it with this. Good. Now after completing the cardiac, we will be getting a multiple phases, like an example 0 to 100 phases will be there. We don't know which phase is good, so else we may have to go by manually only. But with help of the cardiac best phase, what will happen it, our system will give us the best systolic and best diastolic phase where the motion will be lesser side. So that will give us by automatically, even this will this technology will make our life easier, so we can able to get it the very good images with help of this. Good. So now you can able to see this is the recon and go inline scoring. So without any post processing, we can able to get it like the CPR sections. And we furthermore we will just see some of the images. Now this is our advanced post processing, name is called the Syngovia. With help of that, you can able to see all the vessels got labeled automatically, RCA, LAD, LCX, everything. So now we can able to see the CPR sections. This will called as a eye view. So eye view is called, so which wherever we are viewing that particular location, we can able to find out this. So with help of this, we can able to get the coronary angiogram with post-processing. And you can able to see this patient is a 92 beat per seconds. So in the single source machine, we might have to give the beta blockers, but this scan is done without beta blockers with help of the retrospective technology. Good. So this is the cinematic VRT. So we can able to see it very nicely, the stent as well as the calcifications, everything. And this is the one of the cardiac patient, which is called as a CABG, coronary artery bypass grafting. So in this, we can able to see from the lima, from the left internal memory artery to up to the LAD, they have done the grafting. Good. And now we can able to see this patient is having some stent is there. For the stent evaluation, with the help of the stellar detector technology, we can able to see it very nicely. Good. Now we can able to find out, see this, the clear stent view will be there. With help of this also, we can able to find out very nicely. Good. And the TAVI procedures nowadays is increasing up. So TAVI full form is called transcatheter aortic valve implementation. So with help of the Syngovia advanced visualization softwares, so we will be getting a annulus cusp measurement as well as the distance between the RCA and the cusp measurement and all, which will be done by automatically. Good. Now we can see this is the stent evaluation. So the patient is having a stent in the LAD and the LCX also. So we can able to see the distal flow is very nicely is there, so that we can able to find out in the, with the images. And you can able to see this images is acquired in the only 2.1 millisievert. 2.1 millisievert is a very, very low dose. And this is some of the cardiac images. Then we will just switch it off with the dual energy, which is our interesting topic, and it's a trending topic also. Right now, we in the industry, we have three different type of dual energies are there. With different type of vendors, they will use some different names. So from the Siemens, we'll call it as a twin spiral and twin beam, and dual source will be there. So twin spiral is nothing. 2 times we may have to do the scan. So we may not able to do the contrast scanning for that. So for that, what we did, we have implemented the twin beam dual energy. With help of our Somatum Go Top machine, we can able to do the 13 application classes of twin beam dual energies. Then followed with that, we have something is called dual source dual energy, which is our unique from the Siemens, the dual source one. We'll just see some of the post-processed images also with now. Now we can able to see these are the non-contrast examination. So first six sets of images. So the gout syndrome, already our Philips guy, Mr. Puneet Sagar, he have showed all the dual energies. So with the various vendors, they will use it for some different technology. With help of the Siemens, we can able to see the gout with the optimum contrast and renal calculus patients, then rosy, monoenergetic plus, and brain hemorrhage. Then heart PBV, it's a unique for the Siemens side. So it's a PBV is called the perfused blood volume. In case if you have the patient is having any myocardial perfused blood and all, we can able to evaluate it. And followed with that, right now in the conventional CTs, we are using up with the DSA technology, which is a digital suppression angiography. With help of the dual energy, we no need to do the plain images also. We can able to do the contrast directly, and we can able to subtract the images with help of the direct angiogram. Followed with that, you can able to see there is one orange color image is there. So that is called the lung analysis. We'll call it as a PBV, lung PBV. It's a perfused blood volume. In case, if you see in the current market, what the people will do, after completing the peripheral pulmonary angiogram, people will tell which side of lung has got affected. Like an example, we may tell approximately around some right side or left hand side lower lobe has got affected. But with help of the dual energies, we can able to tell which part of the lung is affected very much precisely, and we can able to do the iodine quantifications as well. Good. And we will just see some of the few clinical images of the all the dual energy examinations. Now we can able to see once we complete the dual energy scanning, we can able to categorize the stones, either it is a uric or oxalate or hydroxylate. These 3 types of material comparisons we can able to do it up. In case what the urologist will do, if it is a uric acid level, they may go with the patient conservative management only. If it is a very higher side, hydroxyapatite kind of stones and all, they may have to go with the lithotripsy. As we all knows, if you do the lithotripsy, there are some complications will be there for the patients. To avoid that, the dual energy kidney stone characterizations, it will be very helpful for us. Good. Now we can able to see, this is the elbow joint examination which we done it. So the patient is having the uric acid crystals are there in the elbow joint. This patient you can able to find out in the green color. So these are the uric acid depositions which we can able to find out in the with the dual energy imaging. Good. Now with the help of the with help of the monoenergetic plus applications, we can able to reduce the metal artifact reduction also. So you can able to see, this is the conventional CT images. So we cannot able to find out surrounding the structures, but within the down images we can able to find out. This is the dual energy CT with help of the higher KeV level. KeV is called the kilo electron volt. With the help of 190 KeV, we can able to reduce the metal artifact reductions as well in this. Good. This is going to be dual energy virtual unenhanced. So you can able to see, this is the contrast iodine images. But with help of the dual energy, we can able to remove complete contrast and we can able to get the plain images in this itself. So we no need to do the complete set of plain images. Once we get the patients, we can able to do the contrast and we can eliminate from the contrast in that itself. The technology will called as a virtual unenhanced. If you can see, this is the contrast based, and in this image itself, we derived with the plain images. Then followed with that, we can able to do the fat map also. So some of the liver donor or transplant patients, we may have to see the LAI. LAI is called the liver attenuation index. So the liver attenuation index and all, what we will do, we may have to do it by manual way only. But with help of the dual energy technology, we will be getting the fat fractions, everything by automatically. Good. Now we can able to see, this is the peripheral angiogram. So in case if it is a older age patients and all, the practical difficulty is calcifications. Many of the patients we may experience with a lower popliteal, we may end up with the calcification. With help of the dual energy, we can able to subtract the calcification and we can able to see the images with the true lumen only. So this is what the direct angio we will call. So in case if the patient is in the semi-conscious level, so we may not able to do the plane as well as the contrast in the same directions. So in that cases, what we can able to do it, we can acquire the dual energy examination. With help of that, we can able to get the very good carotid and cerebral angiograms with help of this itself. Now you can see there are some various images are there. So in this patient, we can able to see the iodine uptake with a very nice iodine uptake in the 40 keV level. Right now in the current scenario, what we are doing it up, we are acquiring the 80 or 140 keV level only, the scanners, the images. With help of the dual energy, once we complete the scan, we can derive the images to the 40 keV level to 190 keV level. So where we can able to see the enhancement pattern all very nicely. So this will be helpful for us the tumor enhancement as well as the lower limb angiograms, then the monochromatic and polychromatic images evaluations as well. So this will be helpful for us particularly in the liver lesions enhancements. Now we can able to see, this is done in the twin beam dual energy, the carotid and cerebral angiograms. So we can able to see it very nice occlusions in the middle cerebral artery. So and we can able to see it in the 100 kV, the enhancement of the tumors is very less. The 70 kV somewhat we can able to make it out better manner, but with help of the 40 or 50 kV level, we can able to see very nice enhancement with this. And this is what I told you, the lung analysis. Now we can able to see this patient is having right side upper lobe is blood volume loss is there. With that we can able to see it very nicely, and the left hand side lungs also we have a low attenuation is there. So with help of this we can able to quantify it. Good. Now we'll just switch into the AI RAD companion, which is our unique technology which we implemented in last 2 years before, we'll call approximately 2 years before. So in older days, if you want to do the reporting and all, we may have to depend the radiologist. Now also we may have to depend the radiologist, but still there are some AI technologies is came, so which will helpful for us to do the with the automatic reporting, then followed with that radiologist verifications opinion only. So now we will see, if you can see one radiologist, if you give the 50 MRs per day, approximately tentatively if you see 425 images, that case our radiologist have to see 1.2 seconds per image, he have to visualize it. 1.2 second single image, it will be very difficult because There will be other ideal hours also will be there, our lunch break, tea break, everything. It will be very difficult for us. But right now, if you see in the current demand, we need this is the particularly India concept, we need the 5,985 radiologists required for us in India. But we have in the 4,118 radiologists only are there in India. There are 31% shortfall is there for the radiologist. So to identify the reporting. So this is what we are doing it. Some of the patients will go without reporting also, particularly for the X-rays and CTs. But in the current technology, so what we are doing it up, we can able to do all the imaging with automatic reporting, with the X-rays as well as some of the CT examinations also. We'll see how this AI algorithm is work. So if you see there are 3 types of algorithm, we will take it up. First, we will see the hair color and the face shape. In example, the gender. So the similar way, this is just for the visualization. If you see now, in all the airports, the people are implementing something is called a Digi Yatra. You may experience with that. So if you just go and stand over there, it will screen your face with the eye retina, it will open it up. If you see around some 2-3 years before, which is a manual way. So similar way, what we done it as a Siemens, we have implemented something is called totally 12,000 to 13,000 different diseases into this AI RAD. So with help of this, we can able to achieve the very good images. Good. In the AI RAD, we have almost in all the modalities. I'll explain you what and all it is. Now, if you see in the chest X-ray, so many of the patients will be getting in the 5 indications. Either patient will be getting a lesions, else pneumothorax will be there, or else atelectasis, pleural effusion and consolidations will be there. So these are the most of the diseases which will be able to see it. I'll just show you some of the following images. Now you can able to find out, see the patient is having the pneumothorax. So which part of the area is having the pneumothorax, the system itself will highlight and it will give us the radiologist reportings. So what our radiologist have to see it, he have to just view either it is given or correct or not. Almost right now we can call 99.9% it is giving most accurate results. So we can able to do just one tick option, then finally we can able to get it out the reports in 5 to 10 seconds itself. Else our radiologist may have to sit and view all those images and we need to get the reportings. Good. Now you can able to see this is the air confidence level, so that everything will give us by system itself automatically. Now most of the patients will be doing it for the what we'll call the bedside X-rays. So that even the bedside X-rays also, there will be a lot of disturbance will be there, kind of the ECG monitor or ECG wires will be there. Even for that also we can able to get it the very good reporting template in this. Now if you see in the CT chest, in this AI RAD award, we are selected in the top 200 companies, top 100 companies. We are in the first, in the 20th level in the AI RAD companion to get the better reporting with the analytical based results. Now, if you see for this CT, some of the artificial intelligence what we implemented. So we all knows the patient will be getting a pulmosolitary lung nodules. We'll call it as a lung CAD. So that lung CAD and all, to identify it, it will be very difficult because our radiologists have to sit and view all those images. But now you can able to see totally how many pulmosolitary nodules are there, that everything will give us. And if you see furthermore, we can able to do even the calcium scoring AI based reporting also. Now you can able to find out these images, the lesions, how many numbers of lesions are there and what is the size of that. So the advantage is, in case if the patient is coming for the follow-up, because what we'll call, so the pulmosolitary nodules and all, our oncologist will suggest us to do every 3 months once to do the follow-up scans. So with that, every 3 months once we complete the scan, so system itself will take the previous data sets, what is the older value and what is the new value, and how much percentages the lymph node is increased, that it will give us automatically. Now in the it is the non-contrast examinations in the CT chest. We can able to see this is the non-contrast aortic root measurements, and the totally in the 9 different area of the measurements it will give us, which is the ascending aorta and descending aorta and abdominal thoracic aorta. So this all the measurements will give us by system automatically with the reporting layouts as well. You can ask me what is the advantage for this. In case If the patient is having any aortic aneurysms and all, so we can able to see it very nicely with this. Good. Now, in case if you see, this is the fracture. So, in case if you have any fractures patients, vertebral body height measurements and all, we can able to find out with this. You can see which vertebral body and what is the in the inferior, superior and end plate changes. That everything will give us automatically. And this is going to be the follow-up screening which I told you. So, it will take the two different type of follow-ups. And now, as we know, around some 2-3 years before COVID came, after COVID, if you see, lot of patients is affecting with the COPD. So, COPD is called chronic pulmonary disease obstructions. So, with that patients and all, we can able to see the opacify score. So, what is the opacification score and what is the lung volume and the lung obesity, everything we can able to find it out. That is the advantage for us. Good. Now, this is the oncological department. What we implemented, something is called the automatic AI based contouring tool. So, for the radiotherapy doctors and all, to give the efficient radiotherapy, people may have to do the contouring. So, this contouring and all, the physicist, the radiation oncology physicist will take lot of time, but with the help of this AI technology, we can able to do the automatic in the single click itself. Even we no need to do the click. So, once we complete the scan from the CT scan, it will go to the PACS automatically. From there it will complete and then the images will send it to the TPS. TPS is called the treatment planning system automatically. So, now we can able to see this much of the AI based auto contourings are available with the Siemens. Followed with that, we are improving some more also. In 2025, in the goal of 1000 AI based automatic contouring, we are going to automatic contouring options we are implementing, including the lesions, asagas vein, all those options. So, you can able to find out these are the things we'll do automatically. And before going with the next topic, I missed it one topic to mention it. In the older days and current scenario also, if you want to do the calcium scoring, we need the ECG gated CT scanners. But with help of the AI RAD technology, even in the normal 6 slice, even in the 2 slice machines also, we can complete the scan if we send it to the AI RAD. So, it will give us the ECG, non-ECG gated calcium score automatically in the system itself. So, which is the FDA approved product also. So, right now, we no need to depend any of the cardiac scanner to do the calcium scoring examinations also. Well, next, our king of the subject, it's a Noyatam Alpha with the quantum technology, which is the current trending topics. Now, we can able to see we have a fully integrated AI camera also. With help of this, we can able to position it. So, already our colleague he have explained it very well. So, how the positioning will do automatically under. So, the similar concept it will do, and it will do the ISO center with help of the 12 anatomical landmarks it will take and it will give us. Good. Now, we can able to see how the dual source is working. You can able to see, this is a small short video. So, you can see this is the single source detector and this is going to be a dual source detector. So, in this video, if you see, in the single X-ray source machine, we can able to deliver only the 500 mA. But in the dual source, we can able to deliver up to the 2700 mA, we can able to deliver the MA level. So, in the dual source technology, if you see, good. There are different type of advantages are there in the dual source. We can able to do the faster scans, particularly for the polytrauma patients. From the head to up to till mid thigh, we can able to get it done the scan in a second. So, you will not believe in a 1 to 1.5 seconds, we can able to do the from the head to till up to mid thigh. So you know very well, for the contrast-based examinations and all for polytrauma patients, it will be very difficult for us. So in the 1.2 seconds, it is a very good advantage for us to get the very good image quality. Now we will go with the quantum technology. If you see, this is the conventional detectors. So the conventional detectors will capture the light signals, but it will go up to the 0.5 only. There will be some decay will be there in the images. But with the help of the photon quantum technology, you can able to see each and every photon will get captured. So that is how we are deriving the image, we are achieving the images of 0.2 mm slice thickness. Believe me, 0.2 mm slice thickness. So which is in the leading technology in the images. So we'll just see some of the case examples of images. Now you can able to see it's a 0.2 mm slice thickness, which is the angiogram, the kernel which we selected. So you can able to find out which is very close to the stent. So the patient is having any, in the stent, if we have some any bend or tend, that everything we can able to get very nicely with help of this. That is the advantage of this 0.2 mm images quality. Now we can able to find out there is a one more option is called the pure lumen will be there. So you can see this is the full of calcifications will be there in that in the bifurcation of the region. So with it's a not a it's a calcification, it is a stent imaging. With help of the quantum technology, we can able to remove the complete calcification and we can able to see the lumen only. It will be very helpful for our cardiologists to do the furthermore stenting. And you can able to find out this is the turbo flash cardiac scan what we did it. This is going to be prospective mode. In the 1 second of the time, we can able to do the entire cardiac examination. Believe me, 1 second. Yeah, we all knows that if you want to do the cardiac examination, at least 5 to 7 beats is required. But with help of the cardiac and with the Noetum alpha dual source scanner, we can able to get the single beat images. This is the image quality what we can able to see it up. This is not the single source images. It is a dual energy CT also, where we can able to see the iodine map as well. And these are the some of the images. You can able to find out this patient is having the calcification in the mid of LAD. With help of the pure lumen, you can able to find out we have removed the complete calcifications and we can able to see without any calcification in this. Now these are the conventional CTs will do. You can able to see that images are very haziness. Now with help of the Noetum alpha also, which is the 1 mm slice thickness, more or less similar, but still bit of resolution is increased. But if you see, this is the 0.2 mm image quality, where we can able to see the crisp and clear image quality. With help of this, if you want to identify the ILD, interstitial lung diseases and all, this will be very helpful option for us. Good. Now we can able to see it. This is a normal conventional CT, so we cannot able to find out any lesions in this. But if we go with the lower slice thickness, we can able to find out something is there in the calyces. And with the help of the dual energy, we can able to see some of the lesion is there in the iodine. Iodine enhancement is there, which we can able to see it very nicely. And these are the images from the musculoskeletal images. So you can able to find out the patient is having the fractures and bone bruises will be there, which we can able to see it nicely in the photon counting images also. These images we are acquiring with a 1024 into 1024 matrix. So which is the very good resolution we'll be getting with help of this. Now these are the some of the glimpse images for the spine, and we can able to see with a very good crisp and clear enhancement in the calcaneum and the foot images. Now you can able to find out this patient is having small chip fracture in the talus bone, so we can able to see it very nicely with this. These are the some images. Good. Now we can able to find out this is the bone marrow imaging. So any marrow distortion is there or not, that is also we can able to see it with help of this. And these are the images of the images. Good. Now finally we ended up the presentations, and I would like to thank you for the Mangala institutions giving this opportunity to present us. Thank you.
Thank you, sir, for your knowledge. Your words were truly informative, and we are blessed to have you here. Now, I request HOD of MIT Department, Mrs. Rakshita Ma'am, to present a memento to Mr. Bhuminathan sir as a token of gratitude and I hope all the students are filling the feedback forms after each session. Lunchtime is like a mini rest button. Make it count. I request everyone to enjoy the meal and also kindly be seated right back after the meal for the last session of the day. I'd like to welcome the speakers for the session. I formally welcome Mr. Ajay Kumar Huli, sir. Now, I would like to welcome Mr. Venkatesh H, sir. No need to call. And I also welcome Mr. Vishal, sir. Thank you. Now, let's hear about the general imaging in radiology. To talk about it, I request Mr. Ajay Kumar Huli, sir, MRI Product Manager, G, to kindly take over the podium. Over to you, sir.
Hello, good afternoon. Great here. You guys are all awake. I'll try my best to keep you guys more awake as much as possible. So I'll just give you a little background about myself, right? I do connect very closely with you guys. I have done the similar course. I did my bachelor's in Bangalore, then I did my master's in Ramachandra University, Chennai, okay? Somewhere around 2007-9. I was the second batch. And I am happy that one of my colleague from Ramachandra is leading this institution here as an HOD. Thanks, and it's an honor to be here amongst you guys. Just for a brain teaser, I would like to start with a question. Question is for all, teachers, students, all together. It's very basic one. Just try. Let's see what good answers we get, right? How well you could define it. So all are from radiology? Okay, great. So final years, how many? Okay, great. So I see 3 of lecturers, right? 1 is going out, but yeah, 2 left. So I'll tell you, the question to start with is, you guys are doing a radiology course, right? BSc. What is radiation before we get into anything else? So, see, it's just an icebreaker, just to understand what you think of it and what we think of it. If you want. Guys,
so radiation is one type of energy.
okay.
It's having magnetic field and electric fields.
Okay, great, good try. Anyone else want to have a try? Girls, please. Everywhere we say that females are leading now. Example is here. So, please. Okay. Looks like boys are better. At least they are not shied off. It's good. See, one thing important that you speak. Okay, you speak, you get these dais to speak. That will help you to grow in many ways, okay? This is the last session. I may not talking about the topic, but we'll come there. But it's important that you guys understand that come out of your comfort zone. Lot of final years, you need to talk, you go have to go for an interview outside, right? You have to start your career. You need to talk. Don't be shy. Until you talk, people won't understand you, what you are, right? So be open. Just to give you a brief description of radiation, it's important for you guys. Okay, 4th standard or maybe 5th, not more than that. So do you guys remember how the energy is transferred from one material to the another material? There are 3 processes: conduction, convection, and radiation. Why do you guys forget conveniently that part of the physics? So radiation is just a process, okay, where the energy is transformed or transferred from one side to the another side, okay? So it is just a process. So the radiation is not harmful. So you, especially for females, that's what I'm saying. Like when you choose careers, you say that, no, I don't want to work in radiation field. Please, radiation is nothing to do with harmful things, okay? It's good that at least you refer to energy and it's not harmful. It's a process where it is transferred, okay? In Greek, that is called radiata. That means emerging from the center, going to the diameter, okay, outside. It is called radius if you draw a line, right? That's how the radiation word was formed. Just brief, I know that your classes are good, you have already done all these things, but just thought we'll refresh so that you are alert for my session, which is more little simplistic. I'll just go through certain things, right? So I come from GE, okay? I work for GE Healthcare. So briefly I was saying I did my education from Ramachandra. Then I joined as an application specialist in GE, right? Then on the field I used to train doctors as well as technologists, how to work with scanners. Then I got an opportunity to work in Philips, right, as a research innovation campus, which is there in Bangalore, as a clinical expert. So that's also one of the other job forms which you could look at, application, then the research. Also I was there. Before all this, I was a teacher like her in Manipal, the main institute here. So we introduced MSc there. That was the first thing which we did there. So after that, I have now come into sales, product, right? I am talking all this because I thought, frankly speaking, I was expecting a different crowd, but when I saw you guys, I was more happy that I will share my experiences across. So sky is the limit. There are n number of opportunities and different way of growing. You can be a tech, an apps, a research, product sales. You could be manager. Whatever you would like to want to do, you can get an opportunity in this field. Okay? It is not only restrictive to certain fields. Okay? So I work for GE today, right, as a product manager. GE as a company is a very vast company. It builds a lot of things, including aeroplane engines, which fly your Tejas aircrafts. Indian Air Force has got Tejas, right? They have got agreement with GE for supplying engines which make them fly. We produce jet engine aircrafts. We produce power in sense of from the sea, current waves, or also the wind energies. And also there are a lot of big power plants which GE helps big countries to establish to cater their needs. One of the sectors is healthcare. Okay? So the strength of the GE is we bring technology from all the ways, from defense to power to clean energy, green energy towards healthcare. So a lot of advancements have come in picture which we have borrowed. I'll show you a couple of examples where we borrowed some defense technology into healthcare, which really is transforming healthcare. It is giving a better patient care. Okay. Having said a few examples of the jet engine and other images are there. So I'll start with MR. Okay, as whatever I know, little bit I know about MR. Okay, more compared to other modalities. I've been working in MR more, right? So I'll start with MR. CT I will touch upon in the last. Just to say a few things which are new, which has come in MR, okay? I'm keeping it very generic, not like GE, Siemens or Philips. What are the new innovations happened in healthcare, especially in MR, That's what we're going to see now, next, right? So guys, what is this? Mic to the green lady there. She was trying to say something. No. Yeah.
So this shoulder joint?
Oh, great. That's the shoulder joint. Yes, that's the right answer. Which machine is being used? Please. Sorry.
MRI, sir.
MRI?
Yes.
Okay, you see these kind of images in MRI? Usually?
Yes.
Okay. See, I agree it is an MR as well as it is a CT also. Okay. I'll just show you. See, this is a CT. Okay. This is a CT. This is an MR. Okay. Okay. So before getting there, why do you do CT? Where all do you do CT? Where all you do MR? Usually, right? That's a generic question. Like if you go to hospital, if you have fallen from the bike, you will do a CT or MR? Why? Bone is nicely seen in CT, right? But if you have a headache, you will prefer an MR or CT? MR. Why? Because soft tissues, right? So MR was not known for its bone imaging. CT was not known for its soft tissue imaging, right? But here, if you see, in MR also now, today you can do bone. That means pregnant ladies, pediatric patients, small hairline fractures, osteophytes, lot of other things could be diagnosed in MR without using a CT. So you can reduce radiation. That doesn't mean that CT doesn't have a role. It has lot other roles. But this is a new technology which we call it as 0T. 0T means it's not exactly 0T. Small time will be there, new 37 seconds. At that point of time, you acquire the echo, time of echo, right? I hope you have learned time of repetition, time of echo, right, in MR, final years. I hope this is just started final year or? Yeah, it just started, okay. So, that kind of a thing. So, you take signal very fast, okay? So, this shows you the strength of your gradients. Your gradients will never come down. Okay, your gradients will be always there and you are acquiring signal continuously in MR. This is the latest technology where you can see MR images like CT. Okay? Any questions anyone has? Please be vocal, okay? If you get any silly question, you can ask. No problems. So, this is CT, this is MR. Okay? I understand this is little new. This is CT, why you know? The table is there behind that head. That is attenuating your radiation. Okay? That is why you are getting that image. MR table doesn't give any signal, right? There is no hydrogen there. So MR, you get more signal from only the human anatomy and not from the table. That's how you are eliminating those unwanted structures without scanning them, right? This is a great example for the future applications of this. You can, going ahead, you can do a lung imaging also with MR, okay? So another example where the 0T is used for your surgery plannings, okay? Similarly for osteophytes, okay? This is CT, this is MR. You can see the osteophyte, right? So most of the times when you do MR for C-spine, patient has pain, but nothing is seen on the MR. They say it's normal. But actually, there may be osteophyte, so you have to do a CT and see. So now you don't have to do a CT, you can do in MR only and see. See, one more thing I'll tell you. Being a technologist, it is important for you to understand the image, and you should be able to give the first read. First read means first report before the radiologist. What is there? If you know what is there, then you can scan exactly what you want to scan. Otherwise, you can just do a routine scan and the pathology may be missing, or radiologist will call you and say like, repeat this scan. But whenever they call you back and say repeat scan, ask them why to do, what you are trying to see, how to see it. That will help you guys to enhance your knowledge, because these sessions, reporting sessions will not be taken separately in your colleges. None of the colleges in India, okay? Try to be more interactive, try to report as much as possible, at least internally see what is the pathology, or after scanning, just bring the report, read the report and see the images and see, correlate what it is, okay? See, I understand you guys have called company people to talk. I just don't want to touch only what we have done. I am also trying to share my experience. I am not trying to teach you guys, just trying to share my experience, how did we learn, okay? So this is the next big technology which we got in industry as a G, where I was talking about a collaboration between defense and healthcare. These elements in the coil, before coil used to be made up of copper to receive the signal, but here we are using something called Inca conductors. Okay, Inca conductors, these are patented by GE. What it does is, basically, it will not allow, once it captures the signal, the electric fluctuation, electric field or magnetic field which generates inside after having a signal, or your RF is cut by a signal, then that magnetic flux is there, right? That will not go outside this element. That element will capture and it will be inside that. It will not interact with the other element. That phenomena is called as J-coupling effect. Okay? That will not happen in this coil. That means you can fold this coil completely, overlap it and do. You will not get any artifacts. I'll just show you that coil. So, this is as light as this, okay? And you could say that it could cover your entire abdomen, chest, pelvis, right? One shot you can do everything. But it is as light as a blanket. These are new generation coils. Okay, anywhere you go outside work, see the coils, how they are. If you get to chance to work with these kind of coils, try and also give us feedback, how does that look like, right? Or feel like. So with this, I can do entire leg, like I can just fold it and do the scanning, right? So these are some new technologies which we thought will bring you to your campus and show it. So if you see, she folds it, and those are the Inca conductors. It has been tested robustly so that it comes minimum 10 years. Okay, so you can use it very roughly, and these were designed materials for COVID-like situations, right? So you can actually wash them, sterilize them. Nothing happens. The material is that soft. Good. If you want to see and hold it, I'll give it to you guys. You can just have a look at it. You can have a look until I finish. So if you see now, these are called coupling effects. So when copper coil goes above the copper coil, the signal drops. But Inca conductors, the signal doesn't drop, because that J coupling doesn't happen. They don't interact in energies, right? That's why your signal will be good. So, see, now I'm just showing you the applications where all it could be used. It can be used anywhere, even with the pediatric patient's head, abdomen, and all that. It is possible with 64 channel system. One more thing, I want to stress on this line here, because see, as you are innovating, you are getting into the new era, like CT, MR also is dependent on number of channels. Like CT, how many slices you say, na? 64 slice, 128 slice, 256 slice. Similarly, MR also has higher channels. Like now we have highest is 146 channel, our top end system, right? Why it is important that it could be able to support such coils, new technologies where you can use more number of elements. If there are more number of elements, you can do much faster scanning. Much faster scanning means patient is less time in the bore. Nobody would love to go and sleep in that for half an hour, right? Everyone wants to come out as soon as possible. So that is also a customer experience. If you are able to take them out as soon as possible, and that is possible because of higher channels, faster scanning, good coils. Okay? Similarly, we have some smaller coils of air. So, these are some new technologies which are already in the market. So, first one is automatic planning. So, don't worry, we are not going to take out the jobs of techs, right? It does completely automatic planning, but you have to see and say that is good enough. Okay? Machine does everything, but it should be supervised. But this helps you to give consistent planning. So every time you can give a same planning for anterior to posterior commissure lines, irrespective of positioning of the patient. So you don't have to worry about the positioned patient, right? Even if he is little angulated, you can get same exact planning as you did last time for follow-up scans, for cancer patients, right? So yes, it will reduce your dependency, but it will increase your efficiency of doing good work. Okay? The same way, air touch, where you can just touch the table and position happens. The artifacts go. Hyperband and hypermaverick vessel is like basically compress sensing. Compress sensing is used for doing faster scanning again. So I'll not get into nitty-gritties of the compress sensing. It itself will take an hour more. But it's like your parallel imaging. It is much faster imaging. In parallel imaging, you skip the lines. In compress sensing, you miss the points. And iteratively, you reconstruct back. By calculating mathematically those points, you will calculate and get those points. So basically, you are sampling only few points and making a full image. So you can do it faster. Now, brain angios, if you would have worked in any of your hospitals, brain angio will take around 5 minutes, 4 minutes for scanning a non-contrast brain angio. With compress sensing, you can do it in 1 minute. Okay? So, again, some few examples of planning knee joint and other things. So, see, like this, automatic planning are there for all anatomies. Different vendors have different kind of anatomies. Okay. This is a 48 channel head coil. Again, a unique thing for G. Why it is unique? It gives you a full coverage of head and only head, no neck into that. Okay, that means complete 48 elements work on head, and you can do excellent fMRIs for resting state and all. You can do lot of repetitions, or I would say like events. If you are doing an event related fMRI or a resting state, you could do a lot of events. Just one small example for it is in St. John's, Bangalore. We have an architect installed. The architect is the name of the machine there. But if you see, we use this brain coil to do the entire brain examination in 2 minutes. Just 2 minutes, including angio. Okay? That means if someone is coming for a stroke patient, he has a half an hour window. If you don't treat or diagnose him in half an hour, he may lose that functionality. Maybe his hand will never work in his life. So it's important that you diagnose as soon as possible and give the result to the radiologist or the doctors to give a treatment which is suitable, right? Till here, it was about the hardware, about the innovations which happened in the coil, right? Now I'll be talking a little bit on software innovation, okay? Software doesn't mean, usually in India the concept is software is free, okay? It's just a software, right? It could come, but software needs a lot of research, okay? A lot of money is put under research for making such neuro algorithms. Many people have to write algorithm. So it's not only software, it's complete neuro algorithm, right? Which runs behind to calculate and understand the signal strength, whether it is white, black, is a pathology, it's not pathology, what it is, right? So you can do faster scanning. Before you used to calculate. So I don't know whether today anyone calculates it. I remember our sir, Paneer Salam, used to say, you have to calculate earnest angle, that is flip angles, okay? The shortest possible angle to get the maximum signal out. You need to calculate it on the paper before entering into the MR system. This flip angle I want, right? MR has grown from there to here where you don't have to calculate anything. System will do it for you. You don't have to worry of anything. So your flip angle, your neck sampling, your parallel imaging, everything is calculated by it. Okay? So you just can say, I want to do T2 scanning in 30 seconds. System will do it for you. Okay? That is how the advantage it is. It will not, and the image quality will not go down. Okay? Clinical example, if you see a tibial nerve, so tibial nerve, it doesn't look like a nerve itself when you do a conventional imaging, very fast imaging. But when you do with AHSCON DL is a basically deep learning, okay, artificial intelligence. You would have been hearing it a lot in many other places. The artificial intelligence is also a major tool in healthcare now, which improves your image quality to significant level. So the machine understands, or the algorithm understands, what is the anatomy, whether it is a nerve, whether it is a fat, whether it is a white matter, gray matter. According to that, it reconstructs the signal and gives you the signal, right? That's how it looks like. So tibial nerve has a striations, that is very well shown. Okay? At the same time, 1 minute, 10 seconds. But if you want to see like this, in conventionally, you used to spend 4.5, 5 minutes. So you're saving 5 minutes, or you're saving 3 minutes, but getting a good image quality. So the basic physics of MR, that is a trade-off between time and quality, today it is a myth. Okay? I always remember this story of like when I was in first standard. That's the only time, okay, don't take it, otherwise I was a backbencher. That's the only time I got out of out for all the subjects. Okay, 100% marks. Only 1 marks was cut in my drawing class, okay. There I drew a rose, black rose. My teacher called me and told there will be no black rose, how are you drawing this, okay. That is wrong. Only that 1 marks I actually lost. But later in my college, when I studying BSc, I read an article in London, because of genetic engineering, they made a black rose. So I felt, ki boss, I should have got that marks. Okay, so nothing is impossible. So the physics what you are learning today in the college, you could challenge it whether it is right or wrong. People say like, no, if you increase time, quality will be good. right, in MR, but that is not the truth. Now we have defined the physics. With less time, you can get good images. Cardiacs, spine, and this is a classical example of multiple sclerosis on the spine. If multiple sclerosis is seen in the brain, radiologists will ask you to screen the spine. Okay? Okay. Sir, all the crap is okay that radiologists will see what is for us, right? So basically you can have more tea times, you can go back home soon, you can reduce a lot of time. Okay? 40 to 50% of the time reduction happens. So that means you are getting 20 cases in a day, you can finish fast and go back home. You can go for a 1 hour football game, or in future if you get married, you can walk with your kids. Okay? In the evening. You get that time. But good thing of this for the patients is they get scanned faster. They don't have to go through that pain and the sound which MR produces for longer time. You can be out in 5 minutes and you'll be back with the family. The family will not have that apprehension that he has gone half an hour, what happened, whether he's alive or not. Right? Many people come and ask what's happening inside, boss. So it helps a lot. It's a great deal in reducing time, artificial intelligence, and this is with all the companies today. Okay? All anatomies. And lot of other applications which are there in MR, which I don't want to go through each by one, but I'll stop here, pause here. If you have any questions for anything, whichever I had limited knowledge, I have told you. You could ask if you want anything to be explained in detail. I could try to do that. If not, I'll get back to you guys. Any questions from anyone for MR? Anything? Next, we'll go to the CT. Anything? Okay. No problems. See, I hope that means you have completely understood it. I'll take it that way. Okay? So, let's go to the CT quickly. I hope I'm not boring you guys, right? This is the last session. Anything after this? Then that means they are waiting to go home. Okay, I'll finish it quick. Spare some more time, just 5-10 minutes. I'll complete this. Okay. So in CT also, in anything which we talk today, we are talking about artificial intelligence first. Okay. Then why GE? What is extra? What we have done? Like that, many other companies would have done something extra. They would have told. As I was representing GE, I am telling you some good parts of what we have done, right? Spectral imaging, true fidelity. True fidelity is again nothing but artificial intelligence-based imaging, okay? The most important thing is positioning in entire course, okay? Your teachers will be putting their heads banging on the head, saying that, boss, learn positioning. That is the most important thing in every modality. Whatever scanning you do, taking image, X-ray, positioning is important. Okay? So we used to have a trick when we write an exam for positioning. We say, keep the region of interest at the center of the cassette and expose. You will get the image. Right? So, having joke aside, positioning is very difficult, especially with traumatic guys, with pediatric population, right? So, what we did is, we understood this is the first step in radiology, and if positioning is good, you can reduce your half of the time, okay? You can do a better quality of imaging. That is why we bought artificial intelligence into positioning itself. So computer helps you to position it correctly, right? So if you don't position, what happens? You will be putting a lot of radiation on the patients. You will be irradiating patients a lot, right? That will be reduced a lot. So this is how the AI positioning happens. This is our positioner which understands and scans the patient, right? Just have a look at it, how it does. Now I am selecting an anatomy which I want to do scanning. I selected chest. I say okay. It is basically scanning the patient. Scanning means it is taking a video or it is seeing the patient through that. Like this, it makes the data. It understands the points where it has to position, right? Then it understands for this height of the patient, this should be the chest region, right? The area which could be covered. So automatically that centering is taken. Okay? That's how it is done, and the table is positioned automatically. So the next big thing is coronary angio, okay? For heart, cardiac scannings, right? So cardiac beats fast, right? Your heart beats fast. So your machine should be faster to capture that motion. 5-beat scanning is what we tell. G can provide, right? 0.35 seconds is the rotation time. This is an interesting technology where you give two different energies in the same imaging and you subtract those energies to get the byproduct of it. So if there is a kidney stone, okay, and we don't know whether the stone is of calcium or uric acid. Uric acid has a different attenuation. Calcium has a different attenuation. Okay, if you give two different energies, you can identify, you can characteristically say that this is calcium or uric acid. Okay, this is that technology. This is called fast KV. It's a spectral CT. It is called as spectral CT. In G, we call it as a gemstone technology. Okay, so you can now, with this technology, we can do a spectral CT where you can do complete iron quantification of the body, iron loads and other stuffs in the liver also. So this is basically a deep learning video. I'll not go through completely, but just have a look at it, how it processes. It gets all the images first as a database. Okay, this is called Atlas images. Then the data points are taken. Input scan is a sinogram, right? That is called sinogram in CT. So that is taken. Then the deep learning is applied to make that image. So each point by point will be calculated and done by software, basically for that algorithm. That is how it improves your images. And these are validated softwares, okay? So, now some basics, okay? I am almost at the end of my presentation. 1 or 2 more questions I'll ask you, just for my sake, that I make sure that I ask it. So, there are clarity panel detectors, okay? So, what is the difference between X-ray system and a DR system? Or flat panel detectors? X-ray cassettes to flat panel detectors. Sorry, anyone could? Where is my... Someone was telling. Please pass it on. I think wherever it stops, we'll ask. The pink shirt. Okay. Guys, I thought you were telling something. If not, you pass it on to someone who can answer. If you don't answer, I'll come back to your teachers. Okay, forget it. So basically, see, before there used to be rows and lines of detectors, right? There is a partition. Even in X-ray cassette, there are rows of filters which they put. Similarly, the later advancement were like rows. Flat panel detectors or DR cassettes or something like that will not have that kind of a concept. It is much more seamlessly integrated. Though there are inbuilt detectors which are 8 down or 16 down, the gap between each lines are reduced significantly. That means it seamlessly becomes one single plane, so that your resolution increases, okay, to significantly. So you will not have any gap in between which is missed out in diagnosis, right? That is how this technology is being demonstrated here. That is why they say that it gives a very good images. That's it. So maybe you would have heard photon counting in the morning, right? Okay, I'll not ask a question on that. But that's the future. Photon counting is the future. The main advantage of photon counting is you give less radiation. With less radiation, with including artificial intelligence, you detect more. You detect more coincidences of that radiation into the detectors and restructure and make those images, okay? I'll keep it that simple and concise. I am closing my presentation. I'll not go into the other slides of it. If you guys have any questions, do let me know. Anyone? Hope is it good session, at least something to, okay. Vishal, yes. You want?
Yeah, hello everyone. My name is Vishal. I take care of sales for Karnataka region, this part of Karnataka, for all these imaging modalities. So I was the one who was interacting with your people here, and first of all, we would like to thank you to provide us opportunity to come and meet you all young minds and all enthusiastic crowd. If everyone is comfortable, I would like to talk in Kannada. Okay, Alva. My colleague Ajay, first of all, he asked some 3-4 questions. Okay, that was not to test your knowledge. Nim knowledge test madakalla adu. Just to wake you up. ಊಟ ಮಾಡಿದ್ದೀರಾ ಚೆನ್ನಾಗಿ, ನಿದ್ದೆ ಬರ್ತಾ ಇರತ್ತೆ. ನಾವು ಎಲ್ಲ ಕಾಲೇಜು ಸ್ಕೂಲು ಪಾಸ್ಔಟ್ ಮಾಡಿನೇ ಬಂದಿರೋದು. ಸೊ ಕ್ವಶನ್ ಕೇಳಿದಾಗ ಯಾವುದು ಆನ್ಸರು ರೈಟು ರಾಂಗು ಅಂತ ಇರಲ್ಲ. ಜಸ್ಟ್ ಆನ್ಸರ್. He is the best example because he has undergone a research-based job. Now he is into product job. So, ನೀವು ಕ್ವಶನ್ ಮಾಡಿ ಆನ್ಸರ್ ಮಾಡಿದ್ರೆ ನಾಳೆ ಇನ್ ಫ್ಯೂಚರ್ ಯು ವಿಲ್ ಬಿ ಡೆವಲಪ್ಡ್ appropriately for this society. If you get scared, if you get afraid to answer alla, problem ಆಗಲ್ಲ. We will be where we are. ಮುಂದೆ ಜಾಸ್ತಿ ಹೋಗೋಕ್ಕಾಗಲ್ಲ. ಸೊ ಸ್ಟ್ಯಾಂಡ್ ಅಪ್, ಆಸ್ಕ್ ಕ್ವೆಶನ್ಸ್, ಬಿ ಬ್ರೇವ್. ನಾವು ನಿಮ್ಮ ಏಜಲ್ಲಿದ್ದಾಗ ನಾವು ಈ ಥರನೇ ಇದ್ವಿ. ಬಟ್ ದೆನ್ ಟುಡೇ ವೆನ್ ಐ ಆಮ್ ಹಿಯರ್ ಐ ಆಮ್ ಟೆಲಿಂಗ್ ಆಲ್ ದೀಸ್ ಥಿಂಗ್ಸ್. ಬಟ್ ಟ್ರೈ ಟು ಬಿ ಮೋರ್ ಔಟ್ಸ್ಪೋಕನ್. ಓಕೆ, ಆ್ಯಂಡ್ ನಾಳೆ ಯು ಬೀಯಿಂಗ್ ಆಲ್ ಇಂಟೆಲಿಜೆಂಟ್ ರೇಡಿಯೋಗ್ರಾಫರ್ಸ್, ಯು ಕಮಿಂಗ್ ಇನ್ ಟು ದಿಸ್ ವರ್ಲ್ಡ್ ಅಲ್ಲ, ಟುಮಾರೋ ವಿ ವಿಲ್ ಮೀಟ್ ಸಮ್ವೇರ್. ನಾನು ಸೇಲ್ಸಲ್ಲೇ ಇರ್ತೀನಿ, ಅಜಯ್ ವಿಲ್ ಆಲ್ಸೋ ಬಿ ಇನ್ ದಿಸ್ ಇಂಡಸ್ಟ್ರಿ, ಮೈ One more colleague, Kiran, who's taking care of sales for Karnataka again, he's also here. So we'll all meet in some place in this world. Naale now meet adaga, we will be happy to see you because we will remember, now we'll bandidvi, now bandbitu nimanna matadsidvi, and you are there in some a good position anta. Okay? So ಜಾಸ್ತಿ ಬೋರ್ ಮಾಡಲ್ಲ, ಹೋಗಿ ಟೀಗೆ ಕುಡ್ಕೊಳ್ಳಿ, ಆರಾಮಾಗಿರಿ, ಮಜಾ ಮಾಡಿ. But thank you to give us this opportunity. Thank you, Rakshita.
Thank you, sir, for your exceptional presentation. It made a significant impact, and we are grateful for your valuable contribution and knowledge shared. Now, I request HOD of MIT Department, Mrs. Rakshita Ma'am, to present a memento to Mr. Ajay Kumar, sir, as a token of love. Before we conclude, I would like to extend my heartfelt gratitude to all who made this event possible. First, I would like to thank our chairman, Dr. Ganapati P. Sir, and vice chairman, Dr. Anita G. Bhatt ma'am, for their continuous support. I also would like to thank our beloved principal, Professor Pratigna Suhasini ma'am, and vice principal, Professor Geeta Lakshmi ma'am, for guiding and supporting in every way. My heartfelt thanks to each of the speakers for their invaluable contributions and enriching the sessions throughout with their expertise. And even like to thank all the teaching and non-teaching staffs for their presence, especially MIT faculties for their immense support. I also thank Mr. Vijesh, PRO, for the technical support. And I also like to thank Mangala Catering for the delicious food provided, and also like to thank technical support team with audio and video. Last, well, we have come to the end of today's conference, and I would like to end the AHSCON 2024 formally by saying this phrase: a good event never ends in the world. They take only a pause and keep us waiting for the next. Let us all wait for the next conference. Until then, thank you all. I request all the students to kindly fill the feedback form and submit the same before leaving. Thank you all.